Healthcare has had a broad focus in our hospitals, that we have these large buildings, so we want to try to bring in as much volume as possible. But then it does become like the diner that has a long list where you can order anything on the menu, but it all kind of tastes the same and it's not very good, versus the French restaurant that is really focused on doing one area of cuisine really well. I think one of the important innovations that is helping inpatient care is how we organize ourselves in the hospital. And rather than a generalist hospital approach where we might have a unit that serves a whole host of different surgical patients, we have what we call integrated practice units that focus on patients who have related conditions. We have floors and teams of nurses, doctors, mid-level providers, care coordinators, social work, nutritionists, who are all focused on one patient population that has, say, a collection of conditions. Then those interventions that we know about that might help are things that people are living with and enacting day in and day out. And so there is a much higher uptake of some of those interventions, and also a much higher rate of innovation, because we're living with those inventions and we're seeing them over and over and over again and coming up with new ideas, and we're able to communicate with the team that we work with over and over again. And so, there's many, many differences between restaurants and healthcare, but there is a lesson there to be learned, which is there is a trade-off between doing everything and focusing in on what are areas that we do well, and then creating dedicated teams around those different patient segment needs. And I think you'd find the patient feels less lost because there's a unit and a team that's used to working together over and over again with patients like them, and you start to see a better match between how we build our systems and the needs of our patients.